Can you hear me? That's better. Hi, my name is Dr. John Nicastro. I'm a healthcare provider here in Las Vegas. There's a lot of stuff going on about coronavirus right now. Some of it accurate, some of it very, very inaccurate. And I figured I would take a moment to make this public. There's a lot of information that we know about the virus. We understand it's virulent, it's very transmittable. People that are very susceptible with medical conditions, underlying conditions, or respiratory conditions are very high risk. We know that. Everyone knows that. The news is telling us that. But there's a lot of other things that are going on in the medical world that we know that's not being addressed. From my standpoint, being a physical therapist, after we peak, after we start to see a downswing, whether it's a month from now, whether it's 6 months from now, whether it's even a year from now, we're going to be dealing with a lot of complexities. Some of it we're accustomed to on a day-to-day basis. Some of it is going to be in an extremely high volume. So I figured this is a good time to discuss about that from our clinical standpoint. When someone is intubated, they're on these respirator machines. They could be there for a day, they could be there for months. During that time, their lungs are being inflated and deflated by the machine, the respirator. But as that's happening and the medical management is being performed, their skin is susceptible to breakdown. The risk for developing severe wounds is extremely high, whether that's on the coccyx, the sacrum, the heels, the shoulders, because they can't be moved. So that's one significant issue that we will see. Another one is the generalized deconditioning. If you've never had an extreme surgery, try being bedbound for a month on a respirator and then someone says, sit up. Well, that's not going to happen. If their blood pressure doesn't tank and they pass out, they're going to find out that their leg feels like 1,000 pounds, and the task of sitting up becomes an incredible challenge, even with the assistance of a couple of people. That's where physical therapists come in. Our jobs, our roles in the aftermath of what this virus is going to do, one way or another, is to take this population of patients, whether they're young and healthy or they were older and they survived the virus. Our job is to somehow get them back to being strong enough to get out of the bed and get out of the hospital. We're going to need those beds for more patients, more than likely. Whether we're seeing you in a home health setting, an outpatient clinical setting, a rehabilitation hospital, or a skilled nursing facility, we're going to be dealing with a very high volume of patients on the downswing of this pandemic. And what that means is we're going to have a lot of patients that we're going to have to deal with the wounds, the weakness, and obviously the compromised respiratory system. Physical therapist, occupational therapist, speech therapist, and respiratory therapist, we all will be on the front lines to try and get these individuals back home, back living life. If you are an individual currently with the virus with mild to moderate symptoms, you're probably home. Hopefully you're in a room that you're not with other people. You have a space in your apartment or your house that you're a little bit more segregated from everyone else. Things that you can do right now to help yourself and help your recovery is as followed. First, walking program. If you are able to get up and walk around a little bit throughout the day, it sounds remedial, it sounds like nothing. But over the day, if you can log some steps and just keep your body moving, it gives your body a little bit more of a fighting chance. If it were me in that situation, the one thing that I would do is I would get one of these. This is called a spirometer. I have dealt with countless patients with respiratory ailments, whether it's lung cancer, COPD, emphysema. The patients that we treated for the aftermath of H1N1, every influenza that we see year in, year out, pneumonia, all of these regrettable ailments. First thing I tell my patients when they're able to is get themselves one of these. It is exercise for the lungs. It allows the lower lobes of your lungs to expand, to get debris out, and to just help aerate the lungs and get more oxygen into the bloodstream, into your tissues. Most people look at this and they want to blow in. Doesn't do anything, obviously. Plain and simple. You want this middle to go up as high as it can, and the little valve over here, you don't want it to shoot up. You want it to stay in the middle. And all you do is inhale the air. Guarantee you this. If you are home with mild to moderate symptoms, and you get short of breath walking across the room, or sitting up is tiring, this is a wonderful idea. Right now, you can still get them on Amazon. You might be able to get them at a CVS or a Rite Aid. They're about $9.99. They are freakishly inexpensive and critical for your lungs because it's going to give you the opportunity to work on those lungs, exercise them. 5 to 10 breaths every couple of hours can make a tremendous difference on your lungs if you are bedbound. I work here in Las Vegas. Thankfully, we haven't seen a huge amount of devastation. We may not. But there's enough cases here that in 3 weeks, 3 months, 6 months, we actually don't know, that we might see a huge influx of patients coming into the secondary facilities, the skilled nursing homes, the rehab hospitals, the outpatient clinics, and we're going to be on the front lines to get these people, get them home. Shoot me an email if you have any questions. I'm here to help, just like all the rest of our first responders, our nurses, our doctors. We all have our part to play. janecastro25@gmail.com. Shoot me an email. Obviously, I'm on Instagram at my NICA physical therapy page and on Facebook. Let's get through this together, guys. We haven't even seen the tip of the iceberg of what it's going to do yet. Again, most people that get it, it's going to be mild, maybe moderate, like a flu. If you start getting short of breath, severely short of breath, that's when you start seeking true medical help. Hot liquids are good. Keep your fluids up. Obviously, so keep some form of nutrition in because your body still needs a fighting chance. This probably isn't going to be cured with essential oils. Sorry to my friends that deal with that. This is going to be more of a medical intervention and giving your body the opportunity to be strong enough to combat it, keeping away when you're contagious. If you're a susceptible individual, staying away from places that are high risk. Pick your battles. Don't go into crowded areas. Don't be hanging out at spring break. I'm not intrinsically afraid of this virus, but I'm not foolish enough to go around 3,000 people when there's a global pandemic. That just seems reckless. So let's make good decisions. We're all in this together. And on the medical practitioners, hats off to the rest of my fellow nurses, doctors, therapists. We're all on the front lines, or EMS, or fire, or military, or police. We're all doing what we can to get through this and keep everyone safe and get them recovered, get them home, and let's start getting back on with life. Thank you.